Hi, so I'm back. It is exactly 1 week since my surgery. Today's Monday. I had my surgery on Tuesday. So we're on day number 7, and I am actually feeling really well. I said I would get back to you guys with some questions as far as what I think is very important to ask. And the thing that I really think is the most important is that you need to know the risks of this particular procedure. Risk number 1 is always going to be bleeding, which is true for any surgery. Now, what you need to know is that your doctor is doing the appropriate thing by checking your platelet count and other clotting factors to make sure your blood isn't going to pour out like water. And basically, most people clot just fine. If you cut yourself, you're going to just put a Band-Aid over it and it's just going to heal. Occasionally, there are people who have conditions that affect their clotting time, and some of these you know about, some of these you probably don't. But it is important that your doctor is aware of all of your health history to make sure that all the factors that could affect you in particular are being noted. The next risk that your doctor is going to tell you about is going to be the risk of infection. For an American neurosurgeon, the risk of an infection is somewhere around the 3%. So I'm only mentioning this one in particular because my particular surgery was done by a neurosurgeon. That is not to say it's going to be any higher if you have an orthopedic surgeon do it. But the point being is that the highest risk of actually getting an infection is after your surgery. If you're not taking good care of your wound and you are not keeping it covered and you're not keeping it clean and as sterile as possible, there is an increased opportunity for bacteria to get in. And things you'll want to watch for are things like redness, itching, anything that looks like irritation around the wound. So the third risk I'm going to tell you about is actually the one that's probably the most depressing because it's one that we don't like to think about, but however, this is surgery. So anytime you are undergoing anything that requires anesthesia, you are actually being brought close to a fine balance between life and death with anesthesia, and there is a risk of stroke or death. In many cases, surgeries are done every day. People are brought up and down, in and out just fine, and you just have to, I guess, play your odds. I know that sounds horrible, but I just don't really have a better way of comforting you other than odds are you're going to be fine, and you need to know that. But it never hurts to ask your doctor how many times he has had a patient, for lack of better words, die or stroke after surgery. So I think as a patient, I do think you actually do have the right to ask that. So this next risk number 4 that I'm going to tell you about, is actually something that's not just specific to surgery, but specific to spinal surgery. And it has to do with the cerebral spinal fluid leak. Because you're going into an area that the spinal column being like this, there is actually a column of cerebral spinal fluid held in that area. There is a very slight chance, and it's actually the national average is about 5% of people develop a cerebral spinal fluid leak from one of these surgeries. So you need to know what your doctor will do if that happens to you, if you happen to be that 5th percentile. And the thing you need to know is it's something that needs to be taken care of by somebody who is a microneurosurgeon trained. And not everybody is. So you need to ask if you're having an orthopedic doctor do it or if you're having a neurosurgeon do it, doesn't matter which, that you need to know what they are going to do if you happen to be in that 5th percentile of people. Essentially what someone who is microneurosurgeon trained is going to do if you do develop a cerebral spinal fluid leak is they are going to find the leak and they are going to properly sew it up so you will no longer have a leak, fixing the problem. The 5th and final risk I'm going to tell you about is something you may or may not already be experiencing. It is actually nerve damage, and when it comes to a nerve being impinged, such as in my situation, the actual disc is impinging on the nerves, I am actually already having some nerve damage, or was having some nerve damage before the surgery, as far as I was having some numbness and some weird sensory things going on, and I was actually starting to get some foot weakness and my foot was beginning to drop. But since the surgery, I'm gaining some of the strength back. However, some of the senses are not completely returning, and it could return someday. I'm not ruling it out, but I have a lot of things going on right now. There's a lot of swelling, a lot of inflammation, so I'm just chalking it all up to the nerve is still a little bit impinged by some of the inflammation, and I may have some long-lasting residual numbness. I may not, I don't know. But I can tell you at this point, the trade-off between having some numbness in my toes versus being in constant pain, I'm just going to smile because it's an easy choice. I mean, I feel like I have a life now, so for me the trade-off was worth it, but for other people it may not be. So questions I did ask prior to going in for surgery is there any chance that this could get better without surgery? For my case, the answer was no, though I tried many methods to try and make it be better without doing surgery. But another question I actually wish I would have asked a lot earlier. I wish I really would have pressured my physician to do an MRI a lot earlier, so I would have known if there had been any change in the last couple of years. But once you have those MRI results, I really do think it's important for your physician to sit down with you and explain what is going on with the MRI and how that disc is pushing, if it's pushing to the central canal, which is the central area of the spinal column. Is it pushing out to the side? Is it pushing forward, backward? Who knows? They need to let you know what is going on. Is the disc, is it dried out? Is it still, does it look gelatinous? Does it look this way? Does it look that way? Can you explain to me, what do you think? Would I benefit from waiting? Should I wait? Should I try this, that, or the next thing? Should I try physical therapy? Should I try chiropractor? Now, it's also important to know that I know not everybody likes to be told everything so blatantly. But when it comes to your health, you need to know flat out the risks and benefits of what you are doing, because as far as the long-term effects of having a surgery, there is a risk that you could reherniate the disc. And in talking to my physician who did the surgery, he had actually a pretty solid opinion that there was less than a 5% chance that I would reherniate the disc, which for me the odds were wonderful. I loved that because I have reherniated this same area. From the best of my knowledge, I've reherniated this same area over and over again over the course of 15 years. So for somebody to tell me a less than 5% chance I'll reherniate, that is excellent. However, I did go to another physician who gave me more or less 50-50 odds that after I had the surgery, that basically they told me I probably will reherniate it again. And that was really kind of depressing news. So talk to your physician and see what they say. See what they say the odds are that you will reherniate, that they will be seeing you again. So really you have to think about the end result of your surgery and what are you going to accomplish from this. And you need to be pretty honest with your doctor when you're talking to them about what you expect to accomplish from having this surgery. In my situation, I was expecting basically that I wouldn't be in pain anymore, and I don't think that that was actually that much to ask. I wasn't expecting to be healed of all nerve damage. I wasn't expecting, honestly, I wasn't even expecting that I'd be able to gain strength in my foot again. I am hoping for the long term, I'm hoping I'm able to get back into running again. I used to be a runner and I would like to be a runner again. So I will probably be able to do everything I've ever done in the past again, but it's just not going to be this year. So I hope I've helped you think of some things you wouldn't have otherwise thought of. At the very least, I hope you do come up with some questions of your own to ask of your doctor, and that you do discuss with them your expectations as well. So to all of you out there who are having surgery, and to those of you who may be thinking of it, good luck, and I wish you the best.